My name is Anne-Merel Kloosterman. I'm 27 years old. I'm Dutch. I was vaccine injured by Moderna, and I'm representing the COVID vaccine injury victims in the Netherlands together with former politician Wiebren van Hagen.
Thank you, Anna. Thank you for talking with me today. Could I ask you about your vaccine injury and when that occurred?
Well, it started in 2021 because at some point the government was threatening with the possibility of being excluded from university if you were unvaccinated. So at that point, I decided to get the vaccine. And actually, after the second shot of Moderna, it went completely wrong. I ended up in the hospital with life-threatening edema, paralysis, inflammation, severe skin condition, a lot of hair loss as well, among other symptoms. So it was quite a road.
Yes, and this started in early 2020. When was the when did they bring on the this is for university, you felt you needed to, you were basically coerced, weren't you? You felt you wouldn't be allowed at the university to study if you didn't get the vaccine?
Well, they were just threatening with the possibility. So to avoid any delay in my studies, I was thinking like, okay, I need to get the jab anyway. And I got the jab in August 2021, and it started in September.
Right, so very, very soon afterwards.
Yeah.
Right, and you were hospitalized, right? You were.
Yeah.
Right.
That as well.
Yes, I'm really sorry to hear that. And how did you become the representative of the vaccine injured in the Netherlands?
Well, at some point, I managed to reach out to Wiebren, the Dutch politician, and he was actually the only one who was listening to my plea for help. And from that moment, we started to work together to get justice.
Right, excellent, excellent. And Ruta, could you tell our audience a little bit about yourself, your background, and obviously what you have found, some extraordinary data?
My name is Wouter Aukema. I'm 50 years old, from the Netherlands. In my professional life, I started as a computer hacker, published my research at DEF CON in 2000 in Las Vegas. With my company Trust Factory, I've analyzed the behavior of computer usage for multinationals and governments worldwide, in millions of people. And ever since I sold that company, I do research into subjects that matter for the Dutch society or worldwide, and also with regards to COVID.
Right, thank you for that. And Wouter, sorry for mispronouncing your name in the beginning. So I understand you have you are a data expert, you are a computer hacker as well. Please, could you share with us exactly what data system you hacked into and what you found?
Yes, I certainly will. Back in 2021, in April 21, I was approached by a German professor, Harald Wallach, and oncologist, Rainer Clement. They were doing research, trying to analyze, based on the Israeli data, how many lives are saved per 100,000 doses of COVID vaccines. And the question they asked me was, can you analyze how many people were reported fatal side effects on? So that would enable us to do a cost-benefit analysis. And this is when I discovered that within the EMA, it is, despite their legal obligation to transparently share reports of side effects, similar to the US FARS system, it is virtually impossible to download these reports.
I'm going to just stop you there, Wouter. So just for people who don't know EMA, EMA stands for the European Medicines Agency, and they are the regulatory body for all the European states, right?
That is correct. Thank you for explaining that. Every EU member state has a national competent authority where people and medical doctors can report side effects. And these national competent authorities in Holland, this is called LAREP. In Germany, it is the Paul-Ehrlich Institute. They have a legal obligation to transfer these reports towards the European Medicines Agency into a pharmacovigilance system, which is called ultravigilance. Here is a URL, which is adrreports.eu.
Just to clarify, this is from the European Medicine Agency website, right?
That is correct.
Okay.
This is correct. This is official European government database. Now, for your information, we are looking at 1,600 different products and some 4,500 different substances. Substances are listed by the character here. So if I want to look for COVID vaccines, I go to substances, then I go to the character C, and then I need to scroll down all the way until I find the COVID vaccines, which are listed here. And there is no way I can look at all the COVID vaccines together. No, what I need to do is one by one click on a particular vaccine or other drug, and then we enter into a dashboard from the European Medicines Agency where they say, okay, this is how much was reported by some age group. And so you get some very basic information of what has been reported with regards to, in this case, Ela Somaran, which is Moderna. If I want to look at the individual data, then I need to go to a menu option here, go to the line listings, and I want to see serious reports only. So these are people that got hospitalized or disabled or other types of serious conditions. And then I need to go here, and then I have access to some details with regards to all the individual case safety reports that came into the EMA for 2024 in this case. You have to go through that process of downloading the data. You have to repeat all these actions 6,000 times for every year. So that is undoable. It will take 100 people 100 years to do that. So what I did is, together with a developer, we developed a tool that automates this process of downloading. And as a consequence, I can now download the entire contents of this EMA database within 2 hours of time. 20 years in the history of the EMA of reporting side effects for all the 6,000 drugs and substances that are authorized in Europe. And when you process that in a database environment, in a scientific database environment, then we can start analyzing that and see if we can derive patterns, signals, if you will, from that data, showing all side effects that were reported towards EMA, from both from Europe and outside Europe, for COVID vaccines and all other forms of starting January 1, 2018. And what you see on my screen are 4 sections. So on the bottom right hand is a timeline. You see a timeline that starts from January 2018 all the way to end of March 2023. I haven't had an opportunity yet to update the data because it is extremely big data. The vertical axis shows the number of case safety reports that were received by the EMA. And I've split that up into COVID vaccines, which obviously starts in January 2021, when they started administering the COVID vaccines. And above, you see all other forms of medication, drugs, substances in Europe and outside Europe.
Oh, I see. Yes.
Okay, so what is interesting to see is that on average, we can see that in Europe and outside Europe, we see some 6,000 reports coming in every.
So where it says
week.
other, this is for all the other drugs, all the other medicinal products. That's
Exactly.
sort of middle panel underneath the colorful squares. That is, just to clarify for everyone, that is for all the other medicines, and below
Exactly.
the panel below that is purely for the COVID-19 vaccines. Okay.
That is correct, Sonny. And so what the first observation we can make from that is that, especially at the start of the COVID vaccine rollout, we see an explosion of reports coming in, which is almost a threefold of all the other medication that is taken by all other people in the world. And that is spectacular. And what we should realize, of course, is that as with any drug, any new medication, as soon as a new medication is authorized, we always see a peak, somewhat of a peak in reports coming in from that medication. But nevertheless, all throughout the 2 years that are included here, we can see that there is a twofold average, twofold more side effects being reported. So this is the bottom right part of the screen. On the upper right hand, the entire constellation of medicines, substances, and products are listed. And the bigger the square, the more side effects were reported for that medication. So here you can see 100% of what is shown below is displayed here, split up by the different brands and forms of medication. All right, then on the bottom left hand, we can see the reactions. So if a patient or a medical doctor makes a report of side effects for a particular substance or a drug, they can here list the type of effects. So this can be headache, I can have pain in my shoulder, I can have a heart attack, I can have thrombocytopenia, all kinds of reactions. These are all the reactions that were reported in this time frame for these medications. The bigger the bubble, the more reports were observed for that particular side effect. And for all these thousands of types of side effects, I can aggregate them by system organ class. So when I click, for instance, on blood and lymphatic disorders in the upper right-hand section here, we immediately see that the reactions change. So it now only shows reactions dealing with this particular system organ class. We can see that the timeline changes. It shows me when these types of reactions were reported, both for COVID vaccines and for other vaccines. And it shows me the products that were involved and the proportion of all the products. Okay, so let me reset the... let's first take a look at COVID vaccines only. So I'm deselecting all other kinds of drugs, and we're now looking at COVID vaccines only. What is the most reported side effect reported for the COVID vaccines? I was flabbergasted by this. It is COVID itself, son.
Yeah.
But I thought the COVID vaccines were going to prevent COVID.
Yes, that's what they told us.
And so I find it surprising to see that this is an observation we can make. Let's take a look at all other forms of medication. So let's go back to the initial starting position, and I'm going to deselect the COVID vaccines. What I see is two observations. If we look at the timeline on the bottom right hand of the screen, I can see a slight reduction in influx of case safety reports when COVID started. And this is in line with the delayed medical care that we saw in Holland, and I think also in the rest of the world. So that confirms basically what we already know. What we don't know yet is the explosion that I see starting in January 2023. Yeah, there is a tremendous increase all of a sudden of side effects being reported, not for COVID vaccines, because I excluded that. This is for all other forms of medication. And when I select this area where that explosion can be observed, the model, the dashboard will automatically adapt itself. And I can see medicines here that I don't know. I'm not a doctor, so I don't know what it is. So I programmed the dashboard so that we can click on a particular product and go to the EMA, to the European Medicine Agency website, where the EMA will tell us what Inflectra is. It is an anti-inflammatory medicine that contains infliximab. Yeah.
Yeah.
It is usually used when other medicines and treatments have failed. For diseases such as Crohn's disease, yeah, colitis, etc., etc. That is the most reported drug. The second reported drug, let me show you, this is dealing with Keytruda. Look at the explosion that is taking place there. So again, let's take a look at the EPA. And to find out from the European Medicine Agency's website, Keytruda is a cancer medicine.
Right. Yes. Yeah.
I can give more examples, but I invite medical doctors and scientists to please take a look at the dashboard and supply the medical expertise themselves. The medications that we see here is.
So just wanted to stop you there. So Wouter, what conclusion would you draw from that? Because we're obviously seeing a link now. So this is for all the other medicinal products. We're seeing a huge influx in case safety reports. And this is for what year? This is for 2022?
This is the third quarter of 2023.
Oh, third quarter.
So this is last year.
Oh, this is last year. Right. Okay. Yeah. And what conclusion would you draw to seeing there's a correlation here happening? And if you could just explain to the viewers what that could be.
I have to disappoint you. I cannot draw conclusions, for I am not a pharmacovigilance expert. I am not a medical doctor. Sure. My expertise is big data, and we are looking at 15 million reports of side effects. And what I do is I extract patterns and insights, if you will, into behavior of large populations with regards to the reporting of side effects. What worries me is what I see. And I see this as an important signal for which I hope that medical doctors and scientists and medical scientists are willing to take a look at this and investigate this. I cannot draw a conclusion. This should be done by the experts. I hope you understand what I'm trying to convey.
I do understand, but one can make a hypothesis, right, that we are seeing an explosion, obviously, in cancers. That's come up a lot, and I've looked into this, and there is quite a lot of evidence now coming out. There's a link between the mRNA vaccines and cancer. So possibly there could be a correlation where as more and more people are getting diagnosed with cancer, then there's going to be more of an increase, a need for cancer drugs like the one you just pulled up. And therefore, one can say, well, we're now seeing a huge influx in case safety reports because there's a greater demand for that particular drug.
I follow you, and I obviously read the literature and the reports on the social media and in the news as well. And I think that this signal, in my own terms, I would say this signal is another confirmation of an underbelly feeling that I have as a non-medical expert. It confirms the signals that we are getting from all over the world with regards to immune problems and rising cancers. Yes.
And the drug before that, before the cancer drug, was on a drug for rheumatoid arthritis and
that is correct. The top drug was Inflectra.
Crohn's disease. These are all things that affect these are all autoimmune diseases. And we know, I mean, obviously, I've looked at a lot of the data myself, especially these periodic safety update reports submitted to EMA. And the autoimmune disease, a huge amount of adverse events to do with the immune system. So a link could possibly be made there, and it's very interesting what you have stumbled across. Now, I want to just clarify. So this isn't essentially, you haven't hacked. It's not data. The data was already there in this system on this website, right?
Yes, that is correct.
It's not like you've hacked into it, like you've stolen it. What you've done is you have made it more accessible for people, more user-friendly, where you've downloaded it all and you've done it in a visual way to show how to basically pinpoint different areas, like which drug is causing the most serious adverse events and all of that. So you can see it, which I think is really brilliant, what you and your colleague has done, you know. So but please correct me if I've misinterpreted what you have done. But am I correct in saying that?
Most definitely. I'm back 25 years ago. I was deep in the hacking community. So I'm a bit of an old school, if you will. Back at that time, hacking wasn't, relating to illegal activities or cyber crime or things that we see nowadays.
Yes.
To me, if you ask me, what is the definition of hacking? Hacking is to make a system do something that it is not intended for.
Yes.
And this, I need to explain, I think. What EMA, the European Medicines Agency, by European law, has a legal obligation to transparently share what is being reported in terms of side effects. And the way they are sharing that with the audience and with science and with medical doctors is this interface. Yeah, this is the interface. This is the only interface that the science community, the public, can use to find side effects. And it is impossible for any doctor to get a holistic overview of signals of what is going on the way I'm showing that in my dashboard. So what we did is, this is the intention of EMA, is to be a little bit transparent, but not offer the holistic overview to everybody. Yeah.
So they're not offering the whole picture. They're giving you a sneak peek, almost like a piece of a puzzle, but they're not.
Yeah, they're offering snippets and 6,000 of them. Yeah, because there are 6,000 different forms of medication.
Right.
In the 20 years of history, and if I want to download the reports for a particular drug, let me show that to you. Apologize. Here, I can only select 1 year. So if I would want to understand the history of all side effects for this particular drug, I need to repeat this action 5 times.
Yes.
For one drug. If I want to go back to 2018, I need to do that 7 times for one drug. Mind you, 7 times, 6,000 different drugs and substances. That's 42,000 times that I need to click on buttons, download files. This is undoable for nobody can do this.
Yes, yes. Now,
So,
Wouter, I'm going to ask this quite an important question is how can people have access to what you've created, your software? Do you have a website or that people can sort of go and see for themselves? I'm just curious if you have that.
Yeah, excellent question. Thank you for asking that. I publish my analysis results on Twitter.
Right.
So I've put the tweet on both the dashboard as well as the raw data, as well as the tool, which is fully in open source, allows everybody to reproduce everything that I'm showing. So I am enabling.
Yes, I'll put that. So, and when I upload this video, I'll put this link so people can go and see it for themselves. Yeah.
Okay, so what I've also done is I have shared the scripts that I have used to process all these downloads into a scientific database environment, open source, so that people can fully reproduce my findings and can utilize the tool, the dashboard, and all the data in a fashion that that fits their scientific needs.
Right. No, that's brilliant. If you could just go back to the data, that dashboard for a moment, because I would like to try something out. So you're able to isolate the so I see system organ class. So obviously this is to do with it's categorizing each of the adverse event reports, grouping them together to do with specific how it's affecting specific organs, body organs. You've got eye disorders. I'm just reading blood and lymphatic system disorders. For cardiac, so obviously we know myocarditis and pericarditis. These are the very they're quite pronounced, these side effects. And they knew that very early on as well. So I'm just curious, if you were to isolate that, what would we see? I guess that would be under cardiac.
So let's take this example. Let's focus on the COVID vaccines for now, and let's take a look at cardiac disorder. So I'm clicking cardiac disorder. Here are the individual reactions. So what is on the product leaflet, is pericarditis and myocarditis.
To enlarge that bit, Wouter, just the...
I cannot, I apologize.
Oh, you cannot, okay. Could you read out for people who can't see? So in the large orange circles, could you just read out some of those?
Yeah, so let me explain what we're looking at. The orange bubbles, every bubble is a particular side effect. In MEDRA terminology, MEDRA is the medical dictionary for regulatory activities. This is what I used. I used the MEDRA database to aggregate these side effects towards the system organ classes that you see here above. Yeah? MEDRA.org. Every bubble is a side effect, is a reaction, and my cursor now is on myocarditis, which is so quite a big bubble because there were lots of reports. Pericarditis is up here. These are the two that ended up in the product leaflet, remember?
Yes.
What is not on the product leaflet is myocardial infarction, palpitations, etc.
Yeah. For people who don't know what myocardial infarction is, it's a heart attack, isn't it?
Exactly.
Cardiac arrest. Well,
yeah, but let me give you another example. And let's take a look at everything except COVID, because I want people to understand that this is not just an attempt to take a look only at COVID. No, this is everything. Yeah. So I'm going to select everything except COVID vaccines, and I can search for reactions. For instance, let's take a look at neo, anything that contains the characters neo, and now it shows all the reactions that are dealing with neo. So we see neoplasm progression, neoplasm malignant, long neoplasm.
These are tumors. So people who don't know what neoplasm, these are sort of cancerous tumors, right?
Yeah, but here is also a neo, which is spontaneous abortions. Yeah.
Yes. Wow.
If I click on this reaction,
huge.
There was there seems to be a large chunk of reports coming in at that particular moment. Let's deselect and let's take a look at the biggest one, which is malignant neoplasm progression. I have no idea what it is. You say it is something like cancer. I understand that. Let's click on this. And I want again to see how there is a duplication of reports coming in early 2023.
Yes.
Regarding this particular side effect.
Wow.
Reported for these drugs.
This is for other drugs. This is, you haven't.
We're not looking at COVID.
No, you're not looking at COVID-19 vaccines. This is for it. This is just what is coming through. Wow. Yeah.
If I do the same and look for reactions that contain carcinomas, for instance, then we can see hepatocellular carcinomas, pancreatic carcinomas, basal cell carcinomas. Yeah. And it shows a distinct different pattern. I hope that we find in this recording, we find medical doctors that can recognize, can interpret what can be seen, what can be derived in terms of patterns and signals from this vast amount of data. That is my objective.
Yes. I also wanted, Wouter, to ask you, if you just put death for an adverse reaction, is there a category for death?
Yes, I have. I can tell from a report whether a report is with is fatal or not. So these are the fatalities. If I include COVID vaccines with that, then we can see here are the deaths that were reported, which I find interesting because most of the deaths were apparently reported in the beginning of the rollout for the COVID vaccines.
Yes.
Also, what I find interesting is that since the start of COVID, there seems to be a reduction in reports, in influx of fatalities, which then starts to come back up again to the normal, if you will, level. Yeah.
Well, and I need to add something to this data as well, because in the Netherlands, they covered up the excess mortality data with privacy legislation. Thanks to the amendment law of January 1st, 2020, regarding access to medical records for next of kin. They made it legally impossible to retrieve these data. And because of privacy legislation, you may only perform pathological examinations of the deceased if a crime is likely to have been committed or if the declaration has been signed. If the deceased did not sign the declaration as a living person, the official cause of death will remain private. In addition, there was also a redefinition of the status vaccinated. It takes 14 days for Moderna, Pfizer, and AstraZeneca, and even 28 days for Johnson before a person is defined as vaccinated. So if you die within that certain period of time, the disease will be recorded as unvaccinated.
Yes. Yes, yes. They did the same in the UK with how they classified vaccinated versus unvaccinated. Yeah, it's so shocking. Yeah, thank you for that, Anna. Yes. Wow. Is it possible, Wouter, to overlay the two graphs so you can see for other and then you can see for the COVID-19 vaccines? Do you see if you could combine them?
Yeah.
Graph.
I will show you.
Wow.
I will just separate them out and then So now we can see this is the normal level of influx in 2018, 2019.
And the orange line, just to cut, the orange line is for the 6,000 other drugs, right?
Yeah, that is correct. That is
So
for all other.
That's for the 6,000, and then the blue line is for just the COVID-19 vaccines.
That is correct.
Okay.
Yes.
Yeah. Well, it's shocking, isn't it?
And then obviously, there has been a massive rollout of these COVID vaccines, and so.
I also wanted. Did you take a look at on the timeline? Are the peaks correlating when they gave out the boosters? You're seeing the sort of the peaks and the troughs.
I have not analyzed it, but I wouldn't be surprised. But I have not analyzed it.
Correlation there with the.
But I can for research purposes. Let me give you an example. I would, to answer your question, what I would do is I would select the COVID vaccines only, and I apologize. I select COVID vaccines only. Then I would simply select all the case safety reports. Then I can take a look at the source data, and you can download that section and compare that to the European Central Disease Control vaccination tracker data for Europe.
Right.
And then you simply overlaid it both, and you can see a correlation in time or not. I don't know at this point. I wouldn't be surprised if there's a correlation, of course. There most certainly is since the start of the rollout. Voila. Okay.
Yes. Yes. Other question, Wouter, I have for you is, what is the total number of case safety reports that you've managed to download?
15 million over the past 20 years.
15 million, right?
15.
This is
15.1.
15. Yeah, 15 million over the past 20 years, you said?
Yeah, since 2002. Now,
2002.
Bear in mind that the ultra-vigilance environment has undergone several major updates. And one of the last major update was in end of 2017. So this is why I've showed in the dashboard a starting moment of January. But I can show you how this looks like if we go back to September 2002, since the incubation of ultra-vigilance. It's big data. 1 second for everything to recalculate, please. There we go. So now I can show you that this is the history of 22 years of history of the EMA database. Yeah.
I mean, that says so much, doesn't it? I mean, they say a picture speaks 1,000 words. You just see that graph. You see going back 20 years, you see for all the other drugs, 6,000 other drugs, the orange, and then you see that blue marker for the COVID-19 shots. It's just astounding. It's really remarkable what you've done. It's very grim data we are seeing here. I mean, there's no other way to describe it. And what is interesting, obviously, we're looking at the tiles now, the squares. Yeah. So obviously Pfizer, the green, is the largest.
In the history of 22 years.
Yes, in the history. Yes, exactly. Yeah.
So even though we have, let's say, 19 years of other medications, despite 19 years of history without COVID vaccines, there's one COVID vaccine that is reported the most in the past 23 years.
Now, Wouter, I'm going to ask you, have you approached the press with all this data you've found? This is remarkable, astounding data. So I think the mainstream media would be all over this. I mean, this is hardcore evidence. What response have you gotten? Have you, just the local press in the Netherlands?
Obviously, the first time that I showed a brief peek into this dashboard was with the interview with Jim Ferguson and Bieber and Ademir. and that got a lot of traction.
Yes.
Which is good. So from that, there is a spin-off with interview requests from Germany, from the US, and that I'm very happy with that. Yesterday, Anna Merel and I spoke to a pathologist in Croatia, Mrs. Dr. Ivana Pavic, and that is the objective, to have doctors take a look at what is happening, because answer your question, mainstream media, I did not have a response yet, but maybe that comes. Well, who knows what happens? I don't know. I have not seen a response from the EMA yet. We'll see.
And there's also a lot of censorship in the Netherlands as well.
Could you elaborate on that, Anna, what you're experiencing in the Netherlands?
Well, they are actually censoring everyone who has a different opinion about the COVID pandemic. So it's pretty hard to reach Dutch society with our information.
Yes. And obviously we know they've been silencing the vaccine injury groups as well, which is just so shocking.
I hope that with this dashboard, I'm putting everything in a perspective, even also the COVID injuries, as opposed to all kinds of other forms of medication. And it shows a perspective, it shows patterns, and I hope that teases the scientific and the medical community to take action, do research for the sake of patients. That is what I wish.
Yes. What is interesting is I was reading recently, I think, was it about 2 months ago? This is in the lower house of the Dutch Parliament. Members of the some parliamentarians were demanding a sort of large-scale study into the ongoing excess mortality rates since 2020. Do you know what's come of that? They were calling for a study looking into these excess deaths, because they were saying for the past 4 years now, ongoing, they're seeing excess mortality rate. I think I read somewhere like 14,000 people have died more than expected yearly for the last 4 years. Anna, do you know what's been going on with that?
Well, I think the hearings will be in 2025 and 2026. So it's pretty late. But
they're pushing it down the road.
Yeah, but there's a parliamentary inquiry, which is the most severe, let's say, investigation that the government can call for. So this is what you refer to will take 3 years to conclude. There is also how do you say that in English? A motion by a parliament member by the name of Pieter Omtzigt from the NSC party. In December 2021, he petitioned for did research into excess mortality.
I see.
And this motion was unanimously voted for, in favor of, and the results there is no result. There is the government, 2 government organizations, Central Bureau of Statistics and the Health Institute, did some research. It took 2 years for some of the vaccination data to be made available to non-independent scientists.
Right.
I don't have access, and I don't have 20,000 euro to pay for access. You also have to pay for it.
Right.
Can you imagine? Yeah. However, there is an interesting phenomenon. In February, the Dutch Bureau of Statistics published a long read on their website with regards to the weekly deaths in the Netherlands for a 2-year time frame, 2021 and 2022, split up between vaccinated people and unvaccinated people. And together with Professor Theo Schetters, we performed analysis on the data that they published. And we published our analysis on Twitter, and that got a tremendous amount of traction, both in the Netherlands as well as internationally. The data was limited, so was our analysis, of course. But already with that limited data, we came to spectacular insights. Now, what has happened last week is that because of the FOIA request, Freedom of Information request, in the Netherlands by a group led by Cyril Wenzel, we now have 3 years of data of 400,000 people that died and were vaccinated. And I have their details when they got vaccinated.
Wow.
And together with Professor Schetters, what we did in the past week very intensively is combine the data set from the Central Bureau of Statistics published in February, together with this new FOIA data from the Health Institute of Holland. And yeah, what we see there, Sonja, is
Share that. Please share that.
I cannot share it with you yet. I apologize. I would love to come into another session with you and with Professor Schetters if he would like to.
Yes.
But so we can plan for that. Again, this is also big data. It requires a lot of serious peer review as well to make sure that.
No, I understand that. No, I appreciate all that you've done, and obviously Anna for your courage in speaking up. How has it been, Anna, for you? Your experience being vaccine injured, living in the Netherlands. What I'm just very interested to know what's more about your story, if you'd like to share.
Well, it's almost like you're waking up in a never-ending nightmare. I think it's our responsibility as adults to protect the well-being of children. So that's what I'm trying to do. And what's also interesting, I'm working with Wiebren, the former politician, and he has established the Corona Schade Foundation with his political party BVNL to combat the malpractice of the COVID through the legal system. So an important aspect will be the vaccine injury. And I would like to call on all Dutch victims who are suffering from vaccine injury to keep an eye on the BVNL website to sign up for the class action.
Right, brilliant. And do you have so obviously in UK, we have some kind of vaccine injury compensation system. It's not much, and it's very hard, I think, to get access to. And I think the threshold is quite high. What is it like in the Netherlands?
Well, there's no financial support at all.
There is nothing. Wow, nothing.
Yeah. Well, they still are not willing to admit that there is actually a vaccine injury. It's a real thing.
Right. Wow. Okay. And then have you, what kind of censorship have you personally experienced with them trying to sort of silence you, I can imagine?
Well, they shadow banning my account on Instagram.
They shut down your account.
Yeah, and also on LinkedIn, they removed my article. So it's pretty insane. Yeah.
Yeah, it's terrible, really terrible. But I think because the numbers are so big, there's so many people who have been injured or know of people who have been injured. I just don't think they can just keep shutting it down, sweeping under the carpet. Do you see more and more people stepping out, speaking up? Is it growing?
It is growing, but a lot of victims are afraid to speak up because once you're vaccine injured, the gaslighting comes from both sides. You no longer belong to the group vaccinated or unvaccinated. So that's pretty hard.
I see.
What is interesting, Sonja, is that they started a Dutch NGO in support of long COVID patients. Yeah, and what I find interesting is that the address of this group is at the same address of the Dutch LAREP, which is the National Competent Authority for Reporting Side Effects. So I find it interesting. I haven't asked them, but whether they consider long COVID to be a side effect or You see what I'm saying?
Yes, I do. Yes. Yes, no, you're both doing very important work. Thank you for taking the time to speak with me and sharing all of that. If there's anything else both of you would like to add, please do so.
Well, I just
thank
truly,
you. Yeah, go ahead, Donna.
well, I truly hope that more people are willing to speak up, because in the end, we are all victims of the same people who are responsible for all the human suffering in the world. And we have to fight this together according to law, of course. But that's the only way to get justice.
Yes.
And thank you so much for having us.
Thank you. Thank you both.